I'm Mason with Oak Testosterone here in San Angelo, Texas, and lately our inbox has been full of questions over BPC-157. Everyone from listeners to weekend warriors wants to know if it's the miracle healer social media says that it is. In this video, I'm going to walk you through what BPC-157 actually is, how it works, and why I use it carefully and not casually. You'll understand what the hype gets right, what it completely ignores, and how to make an informed decision before you ever even touch it. We'll cover how it triggers healing through the VEGF and nitric oxide pathways, why that mechanism raises legitimate questions about cancer risk, what evidence we have from animal and early human data, and what safer options you should try first, maybe like extracorporeal shockwave, PRP, or plain consistency with recovery work. Because here's the truth. I love BPC-157, and we've seen incredible results with it, especially with chronic and stubborn tendon/ligament injuries, but I refuse to hand it out like candy just because TikTok made it cool. This stuff isn't regulated, it's not FDA approved, and if you're not working with someone who understands peptides, you're gambling with chemistry that still doesn't have long-term safety data. I want to start by saying I love BPC-157. Anecdotally, we've had amazing results with it. Chronic tendonitis, epicondylitis that has failed all other traditional treatments. I bring BPC on board and they get better within a week or two. However, I don't ever want to recommend BPC without having the talk. The talk is not sexy, is overall boring whenever social media is super hyping this up. It would make it easier to sell, and frankly, many clinics just hand it out like candy. However, I am in the business of making informed patients of the risk, benefits, alternative treatments of these compounds that have limited human safety behind them. This empowers patients to be involved with their treatment plans and helps me sleep better at night. So let's just do an entire lesson over BPC-157. BPC-157 stands for Body Protection Compound 157. It is a 15 amino acid fragment originally isolated from gastric juice. In animal models, it looks like an all-purpose repair signal, helping heal muscle, tendon, ligament, gut, bone, and even nerves. But here's the biggest takeaway and the key point. Almost all of these studies are in animals. We don't have robust human clinical trials yet, and we don't have any long-term safety data. Mechanistically, it seems to operate through two main routes: angiogenesis, which means building new blood vessels, and nitric oxide signaling. When BPC-157 stimulates the VEGF receptor 2, it triggers a cascade inside of that cell. That cascade activates protein kinase B. Sometimes this is called AKT in research papers. Protein kinase B is like the construction foreman of your cells. It tells tissues to survive, grow, and repair instead of dying off. Once protein kinase B is awake, it turns on eNOS, endothelial nitric oxide synthase. Now, eNOS is the enzyme that makes nitric oxide the gas that relaxes your blood vessels and increases circulation. Usually, eNOS is locked down by a protein called caveolin-1, which acts like a safety switch. BPC-157 appears to remove that safety lock, so eNOS can fire up and start producing nitric oxide. More nitric oxide, better blood flow, faster repair. Ligaments, tendons, nerves have poor blood supply. This improved blood flow helps migrate growth factors, healing factors. Now the damage and the inflammation that's been hanging out can be cleaned up. So what is my biggest fear of the unknown with BPC? The VEGF and cancer question. This is the big elephant in the room. If BPC-157 helps grow new blood vessels through VEGF, could it feed tumors? Here's what the research actually shows. In animal and cell models of injury, BPC-157 increases VEGF signaling and blood vessel formation in healthy tissue. In cancer models, data is limited and mixed. Some lab studies show no effect or even inhibitory effect on certain melanoma cells. But again, we don't have the long-term human data to say it's definitely safe. An important piece to put on the table. Oncology already uses VEGF blocking treatments. The fact that cancer therapy relies on shutting down VEGF signaling underscores how critical and powerful this pathway is in tumor biology. So when we talk about using BPC-157, which appears to stimulate the aspects of the VEGF cascade, it's not just theoretical biology. It's the same pathway oncologists are targeting for suppression. Now, that doesn't mean BPC-157 will cause cancer, but it does raise the level of caution for patients with current malignancy or high-risk history. The cancer risk is theoretical, but there is some biology behind it, but definitely no proof. If someone has a current or recent cancer history, I treat BPC-157 as a never use or even consider medication. We also make sure people get appropriate cancer screening if they're up to date on, their colonoscopies, their mammograms, their pap smears, etc. We take that into account before recommending. What evidence do we actually have? In animal studies, it helps tendons, ligaments, muscles, and gut mucosa heal faster and stronger. There's even a small uncontrolled human series suggesting pain improvement, and that's with intra-articular knee injections, but that's it. One study. There's no large randomized trials yet. Millions of good anecdotes, but no human safety studies through legitimate agencies. BPC-157 is not approved for human use by the FDA. It's banned by WADA for drug-tested athletes, and so if they're an athlete, we're not going to recommend it because they'll get flagged for it. Many online products are poorly regulated and the label may not match the contents. If you're getting your peptides from the same site that sells SARMs and Dragon Breath pre-workout powders, maybe skip that. What should we try prior to BPC-157? For joint, tendon, ligament pain, formal physical therapy, mobility and strengthening work, adequate sleep should be at the top of the list. We have the extracorporeal shockwave machine, which has amazing results. And really, I'd rather do 3 to 6 sessions of this over BPC if they have epicondylitis or a tendinopathy, Achilles tendonitis, something like that. We have amazing results with this and more literature and human safety data to show that it's effective and safe. PRP injections also help joints and ligaments and tendons, and it has good studies behind it. Various supplements like collagen, glucosamine, chondroitin, fish oil may have some utility. For gut health, rule out H. pylori, stop NSAIDs, treat root causes, add prebiotics, postbiotics, fiber, optimize sleep. We'd get a colonoscopy first if you're having severe symptoms to rule out anything major. To kind of summarize, BPC-157 is an adjunct, not a shortcut. Even if we do use BPC-157, I'm typically recommending all the other stuff anyways, and we'll bring it in later in the treatment algorithm, not first line. And so if you still choose to use it, work with a clinician who understands peptides, use the lowest effective dose, short cycles, and stop if there's no benefit. Ensure your pharmacy uses sterile compounding for injection products and lab testing. Don't use research chemical websites as it could be literally someone mixing it in their bathtub and you're relying that they can do math and appropriately dose this sterile medication and get it to you without a single bacteria in the solution. And always remember, absence of evidence is not the evidence of safety. BPC-157 activates a VEGF pathway. This activates protein kinase B, which activates eNOS, which activates nitric oxide, which activates new vessels and healing. This pathway is great for repair, promoting growth factors, healing factors, pain reduction, healing, and more functionality. But also it's theoretically great for cancer too, which is why we need more data just to make sure that it's safe before bringing on to everyone's long-term joint pain treatment. If you use it with eyes wide open and with a plan. If you don't, just keep doing the boring stuff. Sleep, protein, movement, and consistency. If you don't want to bring PPC on board, but you do want more joint, muscle, tendon, pain relief options, ask us about Shockwave or PRP. They do have more long-term human safety studies on them. Thanks for watching. Drop your questions below and I'll update you as new human data comes out. Stay healthy, stay curious, and as always, don't buy mysterious powder from the dark corners of the internet. If you're liking this content, be sure to like and subscribe if you haven't, and be sure to get out there and do something today that your future self will thank you for.